Hi, I'm Dr. Ben Dodd, and today we're going to talk about gallbladder disease. Gallbladder disease is very, very common in the modern Western world, with between 1 in 5 and 1 in 6 patients, adult patients, having gallstones or other problems with their gallbladder. This is probably because of our Western diets and lifestyles, so it's a very, very common problem. Gallbladder disease consists mostly of gallstones, but also some patients develop polyps in the gallbladder, which can give rise to gallbladder cancer risk. Gallstones themselves cause 4 main symptoms or diseases in the gallbladder. The gallbladder sits underneath the liver and is a receptacle or a storage reservoir for bile, as it is constantly produced by the liver. The gallbladder builds up a store of bile between meals, and then when people eat, hormones from the stomach make the gallbladder contract, and it squeezes the bile out into the bowel just below the stomach. Gallstones form in the gallbladder and basically interfere with drainage of bile from the gallbladder or cause further problems down in the bile ducts below. So the 4 main problems that patients get from gallstones are pain, where the gallbladder is squeezing against the blockage created by the gallstones at the neck of the gallbladder as it tapers down to become a duct. So severe pain, usually high up in the abdomen, more so on the right, usually radiating through to the back or shoulders, usually after fatty meals or waking patients from sleep, often associated with a very strong sensation of bloating or lots of burping, quite prominent nausea. And so that's the first problem patients get, is biliary colic, gallbladder pain. The second problem is if you get a stone blocking that gallbladder drainage of bile, and if that stone becomes impacted in the neck of the gallbladder, then patients get a chemical irritation of the gallbladder, which is acute cholecystectomy, and in the severe form, the gallbladder becomes contaminated with bacteria from the gut below, and that basically leads to a pus formation in the gallbladder, and patients become very sick and need the gallbladder removed emergently. So the third problem is, as the stones, if they're small enough, travel out of the gallbladder, they can get impacted in the bottom end of the bile ducts and block the flow of bile from the liver into the gut. These patients can get jaundice, where they get very yellow eyes, dark urine and pale stools. And with this blockage, patients can get a superimposed or secondary infection in the bile ducts called cholangitis, which can be very serious. Or as the bile ducts come down from the liver and the gallbladder, they tend to merge with the duct coming from the pancreas, or the pancreas duct. And if the stones block the flow of pancreas digestive enzymes from the pancreas gland, patients can get pancreatitis, which can be a very serious medical condition and can keep normally fit and young patients in hospital for months. And so if you ever get pancreatitis from gallstones, you will have it strongly recommended that you have your gallbladder removed. So 4 main reasons for gallbladder surgery from a gallstone point of view. With gallbladder polyps, these are a more rare problem, most commonly seen in middle-aged ladies. And the understanding of gallbladder polyps has improved a lot in the last 10 years. Historically, removal of the gallbladder was reserved for patients with very large gallbladder polyps. Now that we understand the link between gallbladder polyps and gallbladder cancer much more clearly, the threshold in all the guidelines around the world for considering gallbladder removal based on polyps alone have evolved. And so now the indications for considering cholecystectomy, that is gallbladder removal surgery for gallbladder polyps, are if the polyps are over 6 millimeters or 6 millimeters in size or greater, or if there's multiple polyps, if patients are female or over 50, or if they've had any sort of gallbladder sounding symptoms. This is where we start to say that you probably should have your gallbladder out because of the perceived risk of developing a gallbladder cancer in the future. And the problem with gallbladder cancer is it's very hard to cure people of, so it's quite a difficult cancer to diagnose at a very early stage. And so when it is diagnosed, unfortunately in an advanced state where it's hard to cure people. So we've talked about gallstones and gallbladder polyps. Now I'm going to talk about gallbladder surgery. I've been doing surgery as a field for over 20 years, and in my limited time, the gallbladder surgery has advanced a huge amount. In this day and age, gallbladder surgery is almost without exception keyhole, and in the vast majority of patients, even elderly and quite frail patients, it can usually be done as a day case. It's very, very controlled. It's minimal pain, very low risk of bleeding or other complications, and the historical risk of having to convert to an old-fashioned open incision along the rib cage or of damaging the bile ducts during the surgery. And these are things that should not happen in 2024 if surgeons are properly trained and paying attention. The surgery takes approximately 45 minutes. It's very low risk for patients. It's very minimal pain because of all the local anaesthetic that we use, and therefore can thoroughly recommend it, confidently say it's the safe thing to do for patients as a day case procedure. So the surgery itself is extremely safe. Furthermore, the risk of side effects from having your gallbladder removed, long-term side effects from the removal of your gallbladder, are extremely low. And many patients with gallstone or gallbladder polyp disease, the gallbladder has probably been dysfunctional for a long time anyway. And so usually patients having their gallbladder removed do not have any long-term side effects. And that's sort of 98 to 99% of people should have no long-term side effects. And I say to patients that you should eat whatever you wish after your gallbladder has been removed. You may well have some temporary bloating or even loose stools, but that's very rare for that to be a long-term problem. And almost without exception, when I see patients 2 weeks after surgery, they say that even if they've had some minor side effects, those side effects have resolved completely. So gallbladder surgery 2024 is extremely safe, almost always a day case. And I think if you're young enough and fit enough for an anaesthetic and your gallbladder is bothering you to any great extent, then strong consideration should be given to having a safe modern gallbladder operation to remove it. I look forward to seeing you to discuss further and answer any questions you might have. Thank you.